Hello students, welcome to the new tutorial class. And as you can see on the screen that we have a chapter called Why Do We Fall Ill? So we will cover the last chapter, which is left with animal taxonomy or animal classification after this chapter. Okay. Now we are doing this chapter because you can know or you know that basically this is the most important topic that we are now going through it. So, we should know something about our health, okay? And make sure that you should go through the literature of the textbook before you move into the tutorials, because these tutorials are a supplement, okay? So, as you can see in some pics, that some diagrams which are more familiar to you now. So, called the coronavirus. So, we will read about some of these microbes which do affect our life directly or indirectly. Let us begin. Now, these are some photo shots from your textbook only, okay. So, please go through them properly. You should know the names and of course, diseases they cause it. So, this particular photo shot is from a bacterium called Staphylococcus, and that causes common disease like skin acne. Similarly, you can see this whole photo shot called Leishmania that causes disease called Kala-Azar. So, these all photo shots are from your textbook, okay. So, please go through them again. And this is the trypanosoma, you can see it here, and it causes disease called sleeping sickness. And this is the one which we are now dealing with called SARS. So, write down the full form of it, severe, write down the word severe, acute, respiratory, 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 TORY, okay, respiratory syndrome, severe acute respiratory syndrome, and the virus for which the whole world is locked down more or less belongs to same category, okay, SARS virus. So, again this photo pic is from your textbook. So, check them properly and make sure that you should know these pics and their somewhat name in particular, okay. Now, this is again you can see the whole magnified form for the bacterium that causes disease called tuberculosis, and this approximately flowchart gives you an idea that what all diseases only this microbe called bacterium causes. Only some of them are there. You might read about anthrax last year, then tetanus, plague, leprosy, these names are known to you, then diphtheria, pneumonia. You can see the whole plethora of diseases are caused by them. But make sure that because of these microbes, it is possible for us to live on planet Earth, because in our own body there are approximately good 60 trillion, check out the number, 60 trillion bacteriums are living inside our body, as well as we have got close to 380 trillion viruses. So, you can see the number are so huge, and because of these microbial flora in our body, we can do all our activities, we can do all our life processes, and they do have played a vital role in our evolution and our survival. Now, before we proceed into the topic, you should know that generally why we fall ill. Basically, what happens that when a healthy individual becomes sick, because of the attack of pathogens, that could be virus or bacteria in particular. Number two, your diet is not balanced. That is one of the big reason. The diet should be nutritious and balanced, and of course, the lack of public health services, okay. So, these three are the main factors that makes us sick. The number one, the microbial attack, pathogenic. Number two, the diet issue, and number three, the public health services are not so great, and hence we have lot many diseases that comes to us. So, when we say health, what do you mean by health, okay? So, health means the physical, social, mental function properly. Okay, there's a physical aspect of it, then social, then mental, right? One word called emotional also. So emotions also a big role that play in our health system to be called as healthy individual. Then question is, if I ask you what do you mean by the term disease, okay? The disease means not at ease, okay? So not at ease is called disease. That means the body is under certain abnormality or disturbance. And disease can be caused by external factor or internal factor depending upon how we get it in our system. And sometimes internal dysfunctionality that I have just told you also lead to diseases. So, we read about them in detail, and disease normally has symptoms when it strikes a body. So, symptoms like pain, the swelling, the fever, these are some of the symptoms that the body is not healthy. Then question is factors that determine whether you are healthy or not. So, what are the factors that determine our health in particular? The number one, of course, that which surrounding we live in. So, surrounding play a massive role in our health, that is the public cleanliness. Then important I have told you is the food or the diet that we consume daily, and then depending upon these economical and social status, that also give you a great aspect for health. Okay. So, all these factors in together combine to give a health stuff that we generally call that we are healthy or not. As I have told you that diseases are under two categories. One is called acute, other is called chronic. So, this question to become or do have a great importance in your question papers. So, do read and write down the differences between acute and chronic diseases. So, acute disease lasts only for shorter period of time. Okay. So, their duration for infection is less or they last for a short time, while chronic go for a long time period. As a result, they do cause lot of distress and economical loss. So, it is caused randomly, anytime it can happen it, but this is called chronic, take a particular course of time. Then the acute disease does not cause major effect on general health. Example, you check it out, the cough or the dysentery, while the chronic do create a big effect on the health. And underline some name such as elephantiasis. It is a disease caused by the various microbes or in particular filarial worms, and then the heart ailments. So, they are the disease that basically last longer and create lot of disturbance in the body psyche. Then question is how chronic disease affect our health. Means we know that chronic disease are the one those last for longest span. Then how does they affect our life in general or in totality? So, as I have told you, they last relatively for a longer span of time. So, health is affected. Then they also hinder or disturbs the growth in the children and cause stress in adult. Then they can make you feel tired all the time, and as a result of the illness it result into increase or decrease in weight depending upon the infection type, and basically they affect our day to day activity. So, basically more or less you can see the whole system is affected. Now, question is what are the things that causes disease. Okay. So, what causes disease according to you? So, as I have told you, we have two factors that causes disease. The first discuss about internal factors. So, number one is hormonal change, because if the hormonal disturbance takes place in the body undergoes lot of changes. Then allergic reaction, some of you may be asthmatic, that is again a dust allergy, the lot of allergies. Then genetic disorder that takes place through the genes from our parents. Then of course, the malfunctioning of body organs, that means the heart failure or the kidney failure or any type of things where the organ fail to perform the function. So, these all are internal factors, while in case for external factor concern, So, that depends upon two main factor. One is your diet, which is not proper, it should be healthy and balanced. If it is not, we have the effects, and then of course, the whole pathogenic germs and microbes that attack a body, bacteria, virus or fungi, depending upon which infection we are getting it. Now, underline these two terms and try to differentiate between the two. One, that what are infectious diseases and what are non-infectious. Okay. As the name suggests, you will get the answer. They are the extrinsic or external disease called infectious, because we get infection from outside. Non-infectious is internal disease, that the body system won't function properly. Then in case of the word called infectious disease, they lead to infection and can affect the whole community. As you can see that we are being homebound, so that affect the whole community. So, in case of non-infectious disease, they do not affect the whole community and they are non-transferable from person to person. So, these two differences you should know, infectious and non-infectious causes. Then we do have some causes that act as an immediate cause and the contributory causes. So, under immediate cause, so these are the actual causes that are responsible for disease. Okay. And these causes can be infectious as well as non-infectious. That means, immediate cause is actual cause, while the contributory causes are, they are not the direct cause that give you sickness. Okay. And then example they are given in case of the data immediate causes, we have all these pathogenic organisms, microbial, so the bacteria, fungi, virus and all these things. And for the other aspect, the diet is the main option. If you have a poor diet, body will again give you different problems, that is the contributory causes. Then of course, your lifestyle, the polluted environment, so they all act as a contributory option. Now, this data you should write it down, because we do get the question that name some diseases and their agents. So, normally in this particular aspect, you know, first one is the virus, disease caused by our common cold, influenza, dengue fever and AIDS. Okay. So, underline the full form for AIDS, acquired acquired immunodeficiency, okay, deficiency, and then the last word syndrome. So, you should know the full form for this, acquired immunodeficiency syndrome for which the HIV stands for, okay, known to you. Then for bacterial infection, we have the typhoid fever, the cholera, tuberculosis, anthrax, we have just seen in the earlier slides. Then fungi cause lot many diseases which are infectious. Then protozoon, such as malaria and Kala-Azar. For malaria, you should know the protozoon is Plasmodium, write it down, Plasmodium, okay, Plasmodium. Make sure I write the full name completely. Plasmodium vivax, VIVAX, okay, underline the name separately. This is also called malarial parasite, okay, malarial parasite. So, these terms are, we do ask in lot many times in examination, okay, Plasmodium vivax, the malarial parasite that causes malaria, of course. Then we have lot many worms in our body, and they causes that infection, and we have learned the disease just now called elephantiasis, in which the body part swells out in particular leg zone and it becomes the size of an elephant, and hence the name elephantiasis. It just swell up like anything. It is very hard to work with when the infection are like that. Then question is, why do we need to understand the feature of these agents? We know that they cause the disease. And the question is, why should we know about them? Because if you know about them, then only we should know that what the treatment could be there and how can we get rid of them. So, underline some features here. So, in case of virus, they need a host, that is the body they need to propagate, because you know if they are out of the body, they are dead. So, when they get the host body, they develop and propagate. Then bacteria, they generally do not live inside the host body, but virus do, you know it. And then these micro multiply very fast. Since they multiply very fast, they spread the disease too soon. While in case of worms, they take a lot of time because their multiplication rate is not at that par as the other microbes are. Now, these are the causative factors that you should make it and write it down in your respective notes copy that you are sitting with. So, make sure the textbook and notes copy should be with you, because that gives you a good boost to study what we are doing it now. So, in case of disease like airborne diseases, the here cause factors are germs and bacteria and virus, as we are now looking into this corona issue. So, airborne disease, they say it. Then examples are common cold and tuberculosis. Then foodborne diseases, so they are caused when you consume the infected food, whether they are the bacterial infection, viral or fungi. The normal problem we suffer from is food poisoning. Underline the word typhoid also is one of the foodborne diseases. Then in case of waterborne disease, you can see that they are infected in water. So, when you drink the contaminated water, you get infected. So, cholera is one of them, and amoebiasis, again caused by amoeba, is one of the issue with waterborne diseases. Then this is the one that we are suffering nowadays called lifestyle diseases, because we won't take care of our body, because we want all luxurious life, then these things do affect us. So, they occur because of poor or unhealthy lifestyle, and all the diseases like heart disease or diabetes or blood pressure, more or less, can be categorized under this category. Then come the disease called vector-borne disease. Underline the word vector-borne disease. Okay. So, normally you know what are vector. So, they are the transmitting agents of these various diseases. So, they are caused due to animals or insects, could be carrying an infectious agent, okay, from a sick person to healthy one. And these animals which act as intermediate, and they between the disease causing germs and the people. So, these agents act as a intermediate between the causative agents or the first host to the second host, you can call it. Then malaria is one of them, you know, it is caused by female Anopheles mosquito, while the dengue and all type of fevers come under vector-borne diseases. Then the next one that we are going to study is the STDs, called STDs, stand for sexually transmitted diseases. They are caused by the sexual contact with the person who is infected. So, we have this disease we already have read about called AIDS, other is syphilis, then you read more about gonorrheas. So, these are some of the STDs. So, you should know that how these diseases are infected and how they infect us. Okay. Now, want to know that what happens when the disease causing germs leave our body. So, when we are infected, what all things keep on happening. So, number one, the tissues and organs in our body where these microbes can get attacked to. So, there are number of ways. So, we will read about them in detail, but here we only talk about 2-3 options. So, number one, if the microbial or pathogen enter our body through the nasal chamber, that means we inhale them, then basically they settle in our lungs. That is what happening in this scenario nowadays. The number two is that when they get into our system, they can also show some symptoms and sign when they affect us. Okay. Sometimes they are specific, sometimes they are not. So, we deal about these further in the tutorial. Then question is, when the infection is in our system, the body has some defense mechanism called immunity, okay, or immunization. So, what basically happen when a microbe attack your body? So, that should be a good topic, you should know it. So, number one what do is that inflammation. So, that is first sign. So, what normally happens that whenever our body is attacked by the pathogenic microbes, our body has an immune system in which it creates the cell that fight against these which are causing the infection, and this process when happens, it recruit, see the mechanism, it recruit the cells to kill the agent that enter the body called infectious agents. While it is been done, a process which is referred is called inflammation takes place. So, inflammation process shows different effects on the body such as fever or swelling. That means, if you get infected and you get fever, it means the immunity is working, because in order to counter the agent that enter our body. As a result, we can say that our likelihood we are going to affected by disease, it is being governed by the immune system, because the moment microbial flora attack our body, the immune system get activated and start doing its job. Then this is the topic we should know it, that what are the principles of prevention. Okay. So, in case of the prevention, there are some of these things that we should know it, and before that, prevention, normally we know this practice, we all do it, that we basically follow the principle of treatment rather than principle of prevention, though we should be first dealing with prevention then treatment. But what are the various treatment principles that normally we follow? That so that we can counter the infectious disease or pathogens. So, number one is we kill them by killing the agents, pathogenic agents, or number two, by reducing the effects of the disease or symptoms. So, that is the principle of treatment, make sure either to kill them or reduce their effect. But in case of prevention, that should be the need of an hour. So, we should go for that also, that we should or we must prevent the infection first. So, that there are many type of things that we should take care of. That is, the first one is the very clean and neat and hygienic surroundings. So, that should be the first thing in order to get prevention. And number two, of course, is the diet, which we have talked too much in the last topics. So, if we can prevent the infection, then treatment will be taken at the back seat. Now, in order to prevent, in order to manage our body line with a good prevention technique, we should first of all strengthen our immune system, because it is the immune system that protects us, and as a result that immunity can only be boosted if you have well nutritious and balanced diet. So, you can see diet play a very big role in our healthy life. Okay. And if your immune system is strong, so what happens? The immune system is basically a network of cells, we read about them, tissues and organs that work together in order to protect our body. So, they build up our defense system. Okay. And as a result, they destroy the pathogenic microbes whenever they enter the body, and for that we have the good cells called white blood cells. Okay. So, they are the first factor that prevent any infection in our body, called the soldiers of our body. Underline the word, the white blood cells. Then what actually happens, that whenever the foreign particles or germs enter our body, the body secretes or makes substance, they are referred as antigens. Okay. The germs, when they enter body, we call them as antigens, and as immune system recognize these antigens, underline the word, it releases antibodies. So, we have got two new terms which lock the antigen and destroy them. So, read on this term again, because this gives you a mechanism of the working of our immune system. So, as the germs, we call them antigens, enter our system, the immune system identify it and produce antibodies to destroy these antigens. So, that is, you should know how beautiful working the immune system perform it. And the ability of body to resist disease, underline this word, define the term immunity we ask you. So, it is the ability of a body to resist a disease with the help of antibodies. So, write down these two terms, that how the antigens are countered and then what is the definition of immunity. And as I have told you, in order to boost immunity, we have some specific method. So, first method is vaccination, that is being performed the day you come in this planet Earth, and you should know that by the age of 18 or 20 years, your body will be having approximately 70 different types of vaccination in your system. You see how much the body is vaccinated to create the immune system. So, it has both the pros and cons of it. So, that we will discuss afterwards. Okay. And whenever our body is affected by disease, the immune system, I have told you, fight against them, and question is that they remember the same microbial flora. If it again attack you in future, so they are ready for fighting with the infection. So, immune system is being, you can say, strengthened or bolstered by mechanism called vaccination. Now, similarly, vaccination contains an agent, that is the pathogenic agent which causes the disease, but they are in weakened or killed form. Okay? So, when they get connected with our immune system, then they form the mechanism that whenever the body get affected in future course of time, they can bind that and kill that infectious agents. So, they said today nowadays we have vaccines for lot many infectious diseases such as polio, chickenpox, measles. You can name these diseases for which the body is vaccinated. Now, here is the thing that I have told you before also, that what are the diseases caused by these microbes. So, we have told you about the viruses, underline all these names: common cold, influenza, measles, mumps, chickenpox, AIDS, and check out the new name, the hepatitis. So, these names should be known because we do ask you examples. Then bacteria we already covered, fungi we have told you, all skin infections. Underline the word protozoans. So, you should know the meaning for the word protozoans. So, proto means primitive and zoons or zoa is animals. Okay, zoa stand for animals. So, protozoans are the primitive animals, you can call it. Okay, and the disease called malaria and kala azar, amoebic dysentery, we already have read about that. And in case of worms, we already have told you, called elephantiasis. So, these terms you should be knowing them properly. Now, here is the one that I have told you, that how our body is affected depends upon how the microbe enter our body. Okay? So, in this case, if the microbe enter through nasal chamber, I have told you, so they causes the infection in lungs. Okay? And if the microbe enter through mouth and it enter into the gut, then disease caused is typhoid. Okay? As well as jaundice, you can say it. Similarly, if the virus that causes AIDS that enter the body through sexual organs during the sexual contact, and they spread through our, underline the word, lymph, and damage the immune system. Similarly, the virus that causes the disease called brain fever, underline the new name, that name is mentioned in your book, called Japanese encephalitis. Underline the word Japanese encephalitis, brain fever. Okay? So, that enter the body through mosquito bite and goes to infect the brain. So, these terms are mentioned in your book again. So, make sure read these whole term and mark them properly, because they always have some point of reference in examinations, and how we get infected when the microbe attack our body. Okay? And then we can see that various causes that we have been told, letting you know. So, in case of immediate causes, contributory causes, infectious causes. So, these are the various terms where they act as a contributory causes when the disease are affected, that we have already told you in the respective tutorial. Now, before moving up into that, so you should know the airborne, waterborne, sexual disease, and animal borne. Underline this, the last one. So, when we get affected when the animal bite us, so basically you have read about the disease called rabies in particular. Bite by the respective dogs or even other animals can also cause diseases. Now, before you wind up this topic, now these are things you should know it, that what are antibiotics. Okay? So, underline the definition, they are the chemicals, medicine or drugs that block the biochemical pathway for bacterium to grow, because you know antibiotics is meant for bacterium infection only. Okay? It won't work with virus. As they have mentioned, antibodies do not work against viral infections, as the virus do not have their own biomechanical pathway, because they only use the pathway of the host cell. So, sometimes we ask you that why antibiotics are not good for the viral infections. So, these things should be known, that what is antibiotics, how they work, and why they are not suitable for viral infection. So, I again repeat that please go through the whole tutorial after only going through the textbook, mark them properly, frame your questions and write them in your respective notes copies. So, make sure take care of your health and have a nice time.